echo the congrats on this event. It's so cool to see many old faces and new faces. I'm Craig Brown. I'm a senior scientist, climate change and health at Vancouver Coastal Health. I'm joined actually by Elise Moreau here from our Healthy Public Policy Unit, and Dr. Michael Xʷməthkwəy, our medical health officer, will be here in the afternoon. So if there's any of those real, public health questions where we need a doctor to answer, he'll do that. Vancouver Coastal Health operates on the traditional territories of 14 First Nations. We're continually, our team, trying to get better at centering and supporting that work, including work that's focused on climate change and health, which is the area that I get to work in. So VCH, Vancouver Coastal Health, typically when you think of a health authority, we think of the 13 hospitals and countless long-term care and other care sites that are operated by the health authority. Where I work is down at the bottom here in public health. So this is all of those projects that protect health in our communities, that try to prevent people from getting sick in the first place. And all of that work, or the vast majority of that work, is partnership driven. So it's with local, regional, Indigenous governments, community-based organizations, including with some people in the room, and hopefully with even more of you as time progresses. And it's kind of this public health umbrella. This is where the work that I'll talk about today sits. So I'm really going to focus on thermally safe multi-unit buildings and how VCH is trying to support work in this space. It's a really important issue to keep people safe during future heat events, especially in existing buildings. And so I'm going to tell you some of the ways that we're taking action there. It's kind of, our original speaker set out that pathways to action bullet. So I'm kind of like under that. I'm just going to share some of what we're doing and hopefully make some connections throughout the day. I'm not going to talk a ton about the health impacts of climate change. We've seen the Chief Coroner's report that followed from the heat dome. We know that it was the most impactful climate-related event in BC's history. The recommendations up on the screen come from the Coroner's report. They kind of escalate in complexity from the left to the right. So the left being, let's create this heat alert response system. We now have BC HARS. It continues to get better every time the group meets, and every heat warning or heat emergency that we confront, it's getting better all the time. It's really figuring out who's who ought to be doing what, and that includes keeping people safe in their homes. The second is really tricky, and noting that there's challenges with the term vulnerability, but we'll keep using it. But identifying vulnerable populations and supporting them, that's pretty tough work. How do we do that at a health region scale or at a provincial scale? Of course, one approach would be a fantastic dynamic database. That's pretty tricky, but the BC CDC and Ministry of Health are working on that. There's other approaches though too, and I want to mention a survey that we're about to deliver called our Speak 3 survey that's going to collect information about people's experience through heat events, but it's also, for those of you interested, it's going to provide information on air conditioning prevalence in dwellings. So I know some of you are interested in that data. It won't be as awesome as Glennis hopes it'll be, but it'll be something. So stay tuned for that. But I think one of the key ways to do this is through relationships. So VCH can't know where every single heat susceptible person is, but what we can do is form partnerships with small and medium, especially community-based organizations. And through those, we can start to identify where people are that really need help. We've done mapping where it shows, which communities, which parts of communities are vulnerable to certain climate hazards. You'll hear me in meetings talking about we need that building level kind of specific data, but even within buildings, and I'm sure we'll talk about this in other talks today, we need to know which person needs help. It could be someone on the south or west facade or higher up. Those suites get hotter, but it could be as a result of all sorts of social conditions. And so trying to contribute to work in that space. It's not easy, but part of what we're doing. And the third rung, which is these long-term risk mitigation strategies, that's part of what I'll really focus on. So all of this work is under the umbrella. We're calling it a right to cool. We know that, for example, tenants have a right to electricity, hot water, heat. Our work, others are using it. It felt like a good umbrella. And in that, we've got to participate in some of these activities on the screen. So we were happy supporters of City of Vancouver's building bylaw that requires some buildings by 2025 to have cooling and filtration. We're continuing that advocacy kind of elsewhere. So our medical health officers, Bonnie Henry being the most famous, she's the Chief Medical Health Officer for BC. There's about 30 of them, and Michael will be here this afternoon, public health physicians. They've got a health officers council. They've passed a resolution to take this right to cool issue to various ministers to try and get it get those conversations going at that level to get it embedded in legislative and regulatory framework. So that's another way that the health authority kind of operates in this space. The paper on the right, which should be on our website now, we underwent a massive website overhaul, and so I've lost some of the confidence in our website currently, where there's a lot of editing still needs to be done. But anyways, we did a jurisdictional scan that looked at kind of what's the policy landscape, what are the various moving parts, and where can we as a health authority intervene, where can we advocate. What we found is that we need to act. If we don't, future heat events will be just as impactful. We need action at multiple scales. It's one of those all hands on deck problems. It's really challenging. And the third one is that, I think it's already been touched on really well, is that we need to understand those unintended consequences. So impacts on affordability, rent evictions, et cetera. We want to advocate that a building adopts mechanical cooling if it means that the people who live there can no longer live there. That's obvious, but how do we, build some sort of policy analysis approach that encapsulates those? And that's part of really what I'm already getting out of being here today, is just refining some of those things that we need to be aware of. The next thing is this AC as medical equipment. So in the Chief Coroner's report, one of the recommendations that the province is going to explore, couldn't we just issue air conditioners to people who need them during heat events? And the answer is yes. It's hard, and we're still waiting on guidance from the province. But certainly the health authority views mechanical cooling as a health-saving measure. I know it's got implications for the grid and for greenhouse gases, et cetera, and potentially for indoor air quality. But we're working on approaches to get air conditioners out to people in a way that's free of charge for those who need it most, to keep them alive through the next extreme heat emergency, whenever that is. We don't know, but we know that we'll experience it at some point, especially as the climate continues to warm. The last thing I'll talk about, and this huge kudos to Elise for getting this project going, but we've now, I think it's okay to say, we're about to release an RFP in partnership with Metro Vancouver, City of North Vancouver, that's going to put together a scope of work where folks look at passive and active design strategies for 5 to 10 building archetypes, 4-story walk-up, et cetera. What are the passive and active approaches that could achieve thermal safety in those buildings? And then what are some of the policy approaches and policy implications to actually take action to get those things implemented? So it's probably going to be a multi-phase project, but we're launching that. And so again, I hope all of this sketches out some of the health authority's role here, some of the key issues that at least we see coming up in this space. Really important work. There's all sorts of complexities to it, though. And the last slide I have is just, this is an op-ed that came out after the City of Vancouver released their building bylaw from a wonderful group of really smart people at UBC, including Dr. Michael Brower, who we work with a lot, basically saying that it's a bit of a misguided policy. We need to rely on passive approaches, urban greening, et cetera, and that there's implications when you run a mini split all day in a closed window environment. What does that do to air quality? Fantastic. I'm just bringing this up. It's a complex space. We need really thoughtful approaches if we're going to manage and maximize all these health co-benefits. That's part of what we're trying to do, and I hope I've shed some light on what BCH is up to in this space, and I'm really getting as much as I can from all of you today, and really happy to be here, so thanks for the time.